Hi, my name is Brittany Boegemann, and I am a Master's of Public Health student at the University of Arizona. Today, I will be discussing a project done in collaboration with El Rio Community Health Center's Health and Wellness Department to evaluate the impact of their weight management for optimal health program on staff and patient participants' health and well-being status. El Rio is a federally qualified health center which operates in Tucson, Arizona. El Rio's patient population is composed primarily of minority groups, with 64% being Hispanic or Latino, 6% being American Indian, and 4% identifying as Black or African American. Furthermore, a high proportion of El Rio's patient population face economic difficulties and insecurity, as evidenced by over 70% of patients being below 100% of the federal poverty level, and over half of patients being covered by Arizona State Medicaid program, known as Access. Studies show that individuals of low socioeconomic status or who are members of a minority group are more likely to become overweight or obese and to develop related chronic conditions. This was demonstrated in the El Rio patient population when, in 2014, physicians noted a growing trend in overweight and obese patients who were suffering from weight-related complications. In order to address this issue, the El Rio Health and Wellness Department worked in collaboration with physicians, nutritionists, and behavioral health providers to develop a 12-week lifestyle intervention that could be offered to individuals suffering from weight-related issues. This program combines clinical provider visits and educational sessions in order to encourage positive behavioral modification and improved health outcomes. The Weight Management for Optimal Health program began enrolling participants into its program in late 2014. Since then, the program has enrolled more than 10 patient and employee cohorts, providing care to over 200 individuals. Since the program's inception, changes have been made to refine the structure and delivery, but the program has retained many of its core features. The purpose of this project was to evaluate program results and to develop recommendations based on an analysis of the findings. To achieve these objectives, a database was created to enter participant information and health indicators. Included in the database were variables collected from pre- and post-intervention assessments and questionnaires, as well as follow-up biometric data available from the patient's health record. After this information was entered into the database and reviewed for quality assurance, analysis was conducted to evaluate cohort results. This analysis was then synthesized into report format, with comparisons provided between cohort groups. Finally, recommendations for improvement were provided to program staff to increase positive results in the future. Evaluation of this program consisted of both process and outcome indicators. Results from 2016 program participants indicated that the average number of sessions attended was 7.6, with 63% of participants attending at least 8 of the 12 sessions provided. Participants indicated difficulty with attending all provided sessions due to personal and professional conflicts. Among participants who attended at least 2/3 of the provided sessions, 41% lost more than 5% of their initial body weight, with individuals losing as much as 9.5% of their body weight during the program's duration. Program completers also showed improved health behaviors as demonstrated through increased duration and intensity of physical activity engaged in, and a greater likelihood to consume fruits and vegetables on a regular basis. From the evaluation conducted during this project, it appears that the program is demonstrating moderate levels of success in these early stages. In order to achieve greater changes in behaviors and health status, the program is encouraged to continue to evaluate results at the conclusion of each cohort to identify areas for improvement and to make appropriate changes to program materials. Through a focus on encouraging participation and engagement both inside and outside of sessions, the program may be able to obtain improved results. Program staff may also choose to provide supplemental resources such as shopping lists and recipes, workout instructions, or passes to attend fitness classes to support program participants as they progress along their weight management journey. Providing such resources and support both during the program's duration and during follow-up may help participants to realize their weight loss goals and maintain a healthy weight. Finally, the program is encouraged to learn more about participant perspectives by conducting focus groups. These focus groups may further help to identify program strengths and weaknesses and changing needs of the patient population. I would like to thank my internship committee members, Dr. Ken Schachter, Maya Ingram, and Diane Hager, for their direction and support during this project, as well as the El Rio Health and Wellness Department and the Western Region Public Health Training Center. Also, I would like to thank you for listening to this presentation. If you have any questions about this project, you can contact me at the email address listed here.